things very well for yourself for a lifetime, so that you don't end up in trouble, as we all advance in age, right? So I don't want our teeth to age. Um, now, uh, this is my wife, Dr. Farad, whom you just saw, and I'll just share a little bit more about myself, my journey. So I've had the fortune of having some very good mentors in my life, and I've also, because of them, I was also a part of a lot of research projects, some very good research projects, and some of these research projects have gone abroad. This is one instance wherein I got to put India on the global map of dental research, wherein we came second in our research that we had done. And I do a lot of lecturing all across the globe. I still teach a lot of dentistry. I know my hair is still more black than white, but I'm still lecturing quite extensively to all age groups, and it's really an honor to do so. Um, I've really been fortunate in my journey of having met such good people, and it's really helped me set the tone for how I want to set my practice, the level at which we want to, go ahead, help our patients in the best possible way, so that they all are winners at the end of it. So, what is oral hygiene and why bother so much about our teeth? I mean, how should we even maintain our gums and our teeth? Now, the whole idea of oral hygiene and its importance is that if you are doing well in terms of oral hygiene, you are not only keeping your mouth clean per se, but you are also building on your personality, right? So, a smile is an important aspect of our personality. Our mouths are also where we eat, we speak, right? And we even do a lot of social activities. You want to meet people, you want to speak to people. So that's what we end up doing more as we start aging and as we start spending more time. Forget aging. I mean, we do this all the time, right? We are all always eating, speaking, smiling, and we never want to stop doing that. But the moment you have one front tooth missing, maybe we all become a little more conscious. We all become more guarded with the way we communicate. Sometimes there are teeth a little at the back, but then they have their own repercussions, which we obviously don't want to have. So these are simple things, you know. So now you see this these two pictures on the left side of your screen, wherein on the top left you see there's a mouth which looks relatively quite dirty, and the same mouth, you know, after getting cleaned up. So this particular individual, he had a lot of trouble with regards to keeping his mouth clean. So if you look at the right side of the screen, he was doing a great job, keeping his that part of his mouth clean. And on the opposite side, he was not being able to do as good a job. So we took pictures of his teeth. We showed him that this is where you're going wrong. You're brushing very subconsciously more only on your left side and not as much on your right side. We educated him. We showed him how you look now and what a clean mouth looks like. And then after that, you know, he could go ahead and keep things clean thereafter. We don't like doing, no dentist in this world likes to do a cleaning, right? So I'm not saying that we don't like our job. We love our job, but cleanings are some things which I feel we should all wish for clean teeth every day of our life, not once in 6 months when, you know, we show up to the dentist, or once in a year when we show up to the dentist, that, you know, the dentist is keeping our mouth clean rather than, you know, we doing it ourselves. So we would really like to motivate all our patients to keep their teeth clean. So I'm going to just share a few small tips and tricks of how do you go ahead keep your teeth clean. Whenever we brush our teeth, as we discussed, it's a very subconscious habit. We are not focusing on anything and, you know, keeping things clean. So what we want to do is we want to go ahead and create a pattern, right? So why do I say this word pattern? Because you have 32 teeth in your mouth, okay? Plus minus 2, 4, 6, 8 at most, right? So we have 32 teeth in our mouth. These 32 teeth, each tooth has 5 surfaces when we clean, right? So you've got the top surface, you've got the inside surface, you've got the outside surface, and then you've got these in between surfaces between all of our teeth, right? So we are trying to clean 160 surfaces every time we brush our teeth, right? So it's very easy for us to miss out on multiple surfaces. So what I urge is follow a certain pattern. That is, first start from the outside of one jaw, finish all the outside surfaces, upper jaw, lower jaw. Then go to the tops, finish all the tops, upper jaw, lower jaw. Then go to the insides, finish all the insides. Once that is done, then you need to go ahead, what you see on the right side of the screen, you need to go ahead and floss your teeth, right? We will discuss a little more about flossing as this talk continues. But this is some very basic and very important tips that you need to follow when you brush your teeth. This will really save you from a lot of visits to the dentist wherein you end up in pain and you have trouble, right? Now, this is a very, very, very common question I keep getting asked. Do we need to floss every day? Well, the answer is yes, we need to floss every day. Now, what's important to understand is the repercussions. What if we don't floss, right? If you don't floss, there will always be food getting stuck between the teeth. Look, food is going to go in the mouth. There's no two ways about that. Food is going to go everywhere. We cannot prevent food from going to different places, especially if you're a non-vegetarian, if you have a lot of fibrous food in your diet, food will all the more get stuck, right? So if food gets stuck and stays there, it's going to lead to decay of the teeth, right? It will lead to deterioration of the teeth. So we want to see to it that this deterioration is being avoided. How do we avoid this deterioration? By only passing a thread between the teeth, right? So you can get this dental floss at any chemist shop. Take a foot long, or maybe you could use the floss stick that you saw in the previous slide, and you could just go ahead, pass it through and remove it. If you all have doubts on how to floss, I will go ahead and share one small little article we have written on how to floss with Mr. Roy, and he can maybe share that with all the participants as well, right? So that will be a really helpful tool for how do you go about flossing, because I know everybody wants to floss, but they don't know how to do it. And when you don't do it right, you end up hurting yourself. So for all of y'all who have attempted flossing but have kind of had a bad experience with it, you'll need to know what exactly you did wrong, right? And you can feel free to reach out to me if you'll have any doubts, any questions. I would be happy to share that article first, and then after you run through the article, if you still have doubts, please, I'll be happy to help you all right? So I'm just a phone call away. Now, repercussions of not flossing. So let's assume we don't floss at all. The teeth in between are going to get decayed very badly. And this is what you can see is an X-ray over here. And you can see the black stuff in the center. That's all decayed tooth. So all of that has been completely destroyed. And the tooth is now a lot weaker, right? We don't want that. We want our teeth to be nice and strong. So it's very important that we save our teeth, our time, our dental visits, and a lot of the other things that go with this, right? Because to have dental pain is definitely not fun. We don't want people to be uncomfortable, right? Should I use a mouthwash every day? This is again another thing, we come across with our patients. They say, oh, but I even use a mouthwash every day. Well, a mouthwash need not be used every day. Yes, I repeat myself, a mouthwash need not be used every day. A mouthwash is something which is only to be used by prescription. All right. So a mouthwash is an antibacterial agent. It's an antibiotic, right? So when you have an antibiotic, you are killing good bacteria and bad bacteria, because our mouth is filled with millions and millions of bacteria. There are some who are good, there are some who are bad, and they are maintaining an equilibrium inside the mouth. Now, the moment you start using these mouthwashes, they have either chlorhexidine or alcohol inside them, which are denaturing to proteins which are existing in the mouth. So these bacteria are nothing but proteins which kind of get destroyed because of the mouthwash that is used. So that disturbs the good and the bad, and that alters that equilibrium that is kind of already maintained inside our mouth. So if you feel that, oh, I need to use a mouthwash so that I have a fresher feeling, you need to use certain sprays which are more they are not as harmful as these mouthwash. I'm not saying the mouthwashes are harmful, but they tend to stain your teeth and they kind of tend to kill a lot of good bacteria as well, which is not really desirable. So the way we work with mouthwashes is they are only given as per prescription after any important surgical procedure that may have been done. Okay, so if we are dealing maybe with a very large infection in the mouth and we've had to do something about it, then I would want to go ahead and prescribe a mouthwash to my patient. So I would want you all to not go ahead and just pick up these mouthwashes across the counters. Of course, companies want to make money, so they want to put across ads which kind of state that that this is going to be a good thing for you, but actually speaking, it does not really help us much, right? So again, very simple, very basic piece of information. How much toothpaste should we be using, right? So you can see on the left hand side, any advertisement you see of a toothpaste company will show you a very large chunk of toothpaste being used. The right amount is actually just like a pea sized, the size of a small pea. That's the size of toothpaste we actually need to brush our teeth, right? We want to see to it that these toothpaste that we are using, they are fluoridated toothpaste, which are used only for adults and children above 6 years of age. Below 6 years of age, you don't want to be seeing to it that you're using a fluoridated toothpaste, because at that point, their swallowing reflex is not completely set. So they tend to swallow that fluoride filled toothpaste. Obviously, that happens involuntarily, and that is not very good for the body, right? So we want to see to it that only 6 years and above should be using a fluoridated toothpaste. Make it a compulsion to check on your toothpaste that it's a fluoridated toothpaste. Now, if you ask me specifically what toothpaste should I use, I would say go ahead and pick any toothpaste from Colgate, right? Colgate does not pay me for saying this, but the reason I shared this is because I want you to understand what are the main ingredients of a toothpaste. A toothpaste is nothing but an abrasive agent, a foaming agent, that is a soap, right, and a flavoring agent. These are the three main compositions of any toothpaste that is right, that is there in the market. Now, the most important thing amongst this is not the flavoring agent and not the foaming agents or the soapy agents, but the most important thing is the abrasive content, right? So what an abrasive content is basically if you have using a toothpaste which is not very well calibrated, the abrasive component, then we tend to scratch our teeth. Okay, and if we scratch our teeth, it's going to accumulate more plaque, more dirt, more debris, right? Which is not something we desire. So what preventive measures can we take for our kids so that they grow up to have nice, healthy, good teeth? Well, we need to see to it that we are constantly monitoring their toothbrushing. So up to the age of 6 years, you want to be monitoring their toothbrushing, right? Because as we discussed, even for adults, as adults, we tend to go wrong. So for a child who really does not understand much about this, it is very important that we stand with them, guide them as to what needs to be done, so that I think somebody's audio has gone off. So if they could please just put that on mute again. Uh, so what I was sharing is that you want to see to it that you are guiding your kids for the toothpaste that needs to be used, right? And for the way that they are brushing. So you have these kid toothpaste which exist, and those are very good, safe options for children. Now, if you have sensitivity problems, which toothpaste should be used? This is a very, very common question I keep getting asked by patients over the phone that, oh, I have a sensitivity issue. What toothpaste should I use? Well, what's important to understand here is that if you have a sensitivity issue, it's very important to understand that what is the cause for the sensitivity, right? The cause for sensitivity can be multifactorial. It can be a whole host of things. So if you are having sensitivity because maybe of some gum issues, because of an abscess, some infection, or maybe a big dental decay, or your wisdom tooth is acting up. So these are all multiple causes for sensitivity. Now, if this sensitivity is not solved, the problem is not solved, then the sensitivity continues, right? So any toothpaste is not really going to solve the problem. Only a dentist can solve your problem. So it is important for you to go ahead and show it to the dentist. Okay, but I'm going to give you one hack in which if you cannot show up to the dentist, let's assume you are out there in the woods, you've gone for a vacation to some forest like place, and you have no access to a dentist, you have no access to a phone network, you have no access to a chemist for any meds, then what things can you possibly do? So it's important for you to include something called as pain out. So pain out is a simple it's a simple medicament which comes like a, it's a gel, right, which you can just apply. It really helps in relieving pain to quite an extent, right? So pain out gel is something you can go ahead and buy off the chemist, and you could just carry this along your toothbrushing kit. Of course, this is not a toothbrush, but this is something you can carry along with you when you are traveling in case you come across some trouble, or let's assume something in the middle of the night sparks up. So you should have something to go to. Let's assume you don't even have this. You can use gloves, right? So gloves and oil of gloves, those are very helpful in kind of numbing up that area a little. So it will give a nice soothing sensation, which will help in eliminating and reducing that discomfort that you may have, right? So I'm just going to repeat myself again. No toothpaste is going to solve your sensitivity issues. It's going to be a dentist who's going to be solving your sensitivity issues. So you need to see to it that you visit the dentist if you have any such thing. And I've shared with you a temporary solution is either use oil of cloves, or you could use this thing commercially available called as Pain Out. It's a product from Colgate again. Again, I'm repeating myself. I have no commercial interest with Colgate. Colgate does not give me a penny to talk about Colgate. I pay for my own Colgate toothpaste. So that's how life is, right? But these are genuinely very good products, which are very helpful, especially in odd times. So I would urge that you'll get these. So is bad breath always associated with our teeth? Well, unfortunately, yes, but most often it is always the bad breath. Bad breath is associated because of, or any foul odor from the mouth is associated with teeth related issues, right? So now this picture, what you're looking at is the top, if you look at the white stuff, that is all teeth, right? But then you can see the yellow and the brown and the black and the bad stuff. So that is all plaque and tartar. Plaque and tartar are nothing but they are bacteria filled, right? So they are filled with tons and tons of bacteria, and these bacteria create an inflammatory response. So what an inflammatory response is, basically it creates a lot of swelling, and hence we tend to bleed, right? So a lot of people tend to notice that, Array, my gums bleed when I brush. So point is that they are bleeding because of this plaque, because of this bacteria inside the mouth. They tend to create a lot of ooze. So if you are having bleeding gums, you most probably have a lot of plaque and tartar in your mouth. Okay, I'm not saying you will have it, but there's a chance that you may have it. So it would be highly recommended that you go to the dentist and get it checked. You could request them to take pictures of your teeth, and then once you see the pictures, you kind of understand, okay, which are the areas in my mouth I'm not being able to do a very good job, right? Because it's a very common question that I brush my teeth twice a day. Still, why do I have so much plaque and tartar? Still, why do I have foul odor from my mouth? So it's not because you brush, but it's because we don't brush all the surfaces of our teeth. The moment you start brushing all surfaces more thoroughly, that's when you will tend to notice that these issues don't kind of hang around there, right? So does my diabetes and my heart disease have any role to play with my teeth, right? So, and how are your teeth associated with your overall health? So I'm going to answer both these questions in one go. Well, when you are diabetic and if you have heart disease, it's actually a problem. Why? Because when you have any you are taking medicines for these diseases, that is for diabetes and for heart disease, these heart diseases and the medicines, they tend to cause a little more swelling of the gums, right? So when your gums are a little more swollen, you tend to accumulate more plaque. So if you have more plaque and more debris around our teeth, that's going to lead to more problems, right? So more plaque, more bacteria, and the gums are a little more fragile because of these medicines. It's a side effect of these medicines. So when you have bacteria and swollen gums, not only will you bleed a lot from your gums every time you brush your teeth, but also these bacteria can penetrate into the bloodstream through your gums and enter the body, right? So if you are having maybe a cardiac stent, right? So these angioplasty stents that you commonly hear about, right? Or somebody has a prosthetic valve of the heart. If any of these have been placed, they tend to get infected even through your gums and your teeth. So it is very important that you show up regularly to the dentist and see to it that your gum health is on top of its game. So things will happen, but it's important that we frequently get it cleaned and we get, at least we are evaluating things thoroughly so that we don't end up with more complex problems which are associated with more important organs of our body, right? And another very important reason why you want to be careful about your teeth is also because it does affect your overall health in general. So when you are eating well, it's purely you can eat well if you have a full set of teeth, right? You can chew your food, you can shear that food. Once that food gets chewed completely and it gets completely masticated and refined, then there are certain enzymes in our saliva which start the digestive process inside the mouth. So it's very important that we go ahead and, if we don't have, if we have a few missing teeth, we should always go ahead and get them replaced and, corrected so that they don't end up affecting us in our overall health, because digestive issues begin from the mouth, and that's the last thing we all desire. My parents have bad teeth. Does that mean I will have bad teeth as well? No, you don't have to blame your parents for your bad teeth. But yes, if somebody has malaligned teeth or a small jaw, uh, these things can be corrected, right? So as you grow, it's very important that you keep visiting the dentist. Especially when your child is growing, it's very important that you see to it, you take them to the dentist at regular intervals, because some people have a small jaw, right? Some people uh, will end up having a smaller jaw because of, maybe certain habits like thumb sucking, or if breastfeeding has not been done for a very long time, for a prolonged time, then they tend to have certain different issues as well with the, with jaw growth. So these things can be caught by your dentist, right? So if there's a specialist dentist who's sitting there, he will be able to catch these problems as the child is growing. And instead of doing major surgery and things like that to correct the jawline and things like that at a later age, these things can be very predictably and very minimalistically corrected at a very young age, right? So we can go and use certain small appliances which go inside the mouth, and those will correct things and make things absolutely perfect, right? So it's very important that we go ahead and uh, always look for intervention. I'm not saying intervention, but look for a checkup, and if any intervention is required, we should go ahead and get it done. That is really going to help the child as he grows, so that they don't end up accumulating more plaque and tartar. Because if somebody has got a small jaw, they will have more crowded teeth. If they have more crowded teeth, they will accumulate more plaque. If they accumulate more plaque, they will have more dental problems, right? So then you have things like decay and gum disease, and nobody wants all of this, right? So it's very important that we go ahead and just get regular checkups and just understand the situation very thoroughly. That's a very, very important aspect of dentistry. What foods are good and what foods are bad for our teeth, right? So again, I'm sure we are all very well versed with all of this, but you want good fibrous foods, you want protein rich foods, dairy products are good, fluoridated water. Again, fluoridated water for children, fluoridated water is normal, but again, this should be very well calibrated. In Mumbai, we don't have such issues, but people who are sitting in the maybe the northern parts in the Jharkhand area, those areas, they tend to have a lot of issues because the fluoride content in the water is very high in those regions. So they tend to have different dental issues all the more because of a very area specific problem. What is not good is definitely high acid containing drinks, right? So colas are not good, alcohol is very bad, and sticky foods are not good, right? So you want to avoid sticky. I'll tell you what, we it's easy to say avoid this, avoid that. What's most important is, even if you are having it, or if you end up having any of these, every once in a while, it's very important that we brush really thoroughly and really regularly and show up for our checkups. And trust me, there will be no dental problems then, right? So again, this is another very common question we keep getting asked. My gums bleed when I brush. Do I need to change my brush or my toothpaste, right? So you can see again, there is plaque and tartar around those teeth. If you look at the top picture, and once that plaque and tartar has been cleaned out and eliminated, you can see how beautiful the gums are looking. They're looking nice and healthy and perfectly hugging those teeth, which is exactly what we want, because the gums are the first line of defense. They have to go ahead and hug the teeth nice and tight so that food does not go get stuck inside. Because if food goes there and gets stuck there, and this inflammatory response which you're seeing on the top picture is constantly there, it actually ends up eating up the bone, right? So you end up loosening your gums, you end up weakening your bone, and then your teeth start to get a little shaky. And we assume that shaky teeth are actually because of my aging process. Well, it's not. When you have shaky teeth, it's because we have neglected our teeth for too long, right? So what we want is, you show up at the practice, show up with your dentist, and every time you show up, just ask them to take a few pictures of your teeth, and you can use that as a record for yourself, so that you understand where are things being done right and where are things not being done so right. So if you look at this patient on the top left, you can see the front teeth are very swollen, but if you look at the back teeth, the gums, they're looking beautiful and perfectly healthy, right? So it's very important for patients to understand and to be educated about the fact that, okay, these are areas where you need to step your game up, because when you brush, you're not usually staring at the mirror and trying to get things fixed. uh, so it's very critical that you spend that 30 minutes with your dentist every 6 months, so that they can guide you as to where do you need to step your game up, and you can be better educated about your teeth. Well, we have a lot of patients who come say, oh, my teeth are getting yellower. What can be done about this? Well, there are procedures like things like veneers. That is, if you are not very happy about the color of your teeth, uh, these things can be done so that they look a lot brighter and whiter and shinier. And there are also some simple procedures called as whitenings done, so bleaching of your teeth, which are very simple, safe procedures which can be done so that your teeth become nicer and whiter, right? Now, if I have a missing tooth, is it okay that we just let it be? Every time you lose a tooth, you may realize that, Arey, I can still manage to eat. Why do I need to go ahead and change this? Why do I need to go ahead, spend time, spend money, get or go through trouble and get all of this replaced? Well, you need to realize here that that it is, when you lose a tooth, your teeth are actually drifting very slowly, and that is disrupting your bite completely. This bite disruption can lead to more complex and bigger problems, which are completely not desirable. I treat a lot of such patients, who have these bite issues because of neglect. That okay, I lost my tooth, fine, but I did not bother getting it replaced. I got busy with work. I found it too expensive, or I just did not feel the need for it. I got used to eating without it. Yes, initially you will feel all of these things, but as time progresses, there are certain changes which take place in our joint. And these changes lead to a lot of jaw related aches and pains, which can even go radiate to your neck, to your back, and all the way across your spine to your, even up to your feet, if in very extensive cases. But if you are in a situation wherein you're having a lot of headaches, a lot of neck aches, and you've been to all sorts of doctors, and they're just not able to diagnose your problem, then maybe going to a prosthodontist or a specialist at bite correction is very, very important, and they may be of significant help, right? So we've helped a lot of patients, kind of correct their own problems. Some people wanted more beautiful teeth. Some people did not like, the gaps. This is a gentleman who's really given me a very, very beautiful line. Uh, you all have transformed me from a toothless tiger to a roaring lion. And this is something which has stuck with me. Uh, so this is again a girl. She had missing teeth in the front of her jaw. We can replace these teeth very predictably. This is a lady. She had no teeth. She was suffering from cancer, and she had a battle of cancer for almost about 5 years. And she was left without teeth at the end of it. And we were we could help her, give her a full smile and a full set of teeth so that she could eat, smile, speak, and enjoy her life. So this is a little bit about us, because at the end of the day, teamwork is what makes the dream work. And I'm Dr. Hussain Haryanawala. I'm a specialist at replacement of missing teeth. We have Dr. Farat on our team. She's a root canal specialist. These are all full-time doctors. We have Dr. Nimay Joshi, is one of the best orthodontists in Southeast Asia. Dr. Manveen Lamba, and then we have Dr. Kalpana, and we have Neha David. She's our manager. So she looks after our practice. So our philosophy of work is a little different. So we focus a lot on documentation. We focus a lot on taking pictures, understanding the situation thoroughly, because we see our patients for a few minutes. We, as I shared with you earlier, in the slides, that we have 160 surfaces to our teeth. There is no way any dentist in the world can remember what is happening on each of these surfaces. So even if we see you after 6 years and 10 years and 20 years, we have a record of your teeth right from beginning till the end. So we like to understand things and try to execute problems and execute solutions in the most relaxing and friendly environments that we can possibly create, right? So we also are focused on very high-end technology. And as I was sharing with Roy, we are coming up with something much, much bigger and better end of this year. As of now, we have this very, very fine piece of machinery. We are the only ones in the country to have this machine. It's a German equipment which scans teeth, so we don't need to make all those gooey impressions if you've been through those. Those days are all gone now. We go ahead, we do scans of the teeth, and so we just run a simple wand inside the mouth, and it captures everything, and all your crowns, everything get fabricated, just by the scan. We don't have to put any gooey materials in the mouth anymore. So that makes dentistry a lot more comfortable. You understand a lot more about what's happening inside the mouth and how you need to go about it. Documentation has also helped us in a very, very big way with regards to how people were. So this particular boy, he had come into us with, he used to come to us in 2015, 2016 for simple cleanings. And we had data of, what his teeth used to look like because of all the pictures we had gathered. In 2020, during the lockdown, he had a fall, and he fell on his face and he broke his jaw. He broke a lot of his teeth. They did about 5 reconstructive surgeries to fix his face up. So on the left side of the screen, his face has been fixed up after 5 reconstructive surgeries. And then he came back to us to replace his teeth. And because we had a record of what his teeth used to look like, we could go ahead and replace everything very predictably, exactly the way he used to look like before. And this all we could only do because of the good technology and the expertise that our entire team possesses. This is another very wonderful story. This lady, she was without teeth for almost 30 years, right? And her dream was to eat pani puri. She's a Gujarati lady. For her, pani puri means the world to her. And for 30 years, she could not enjoy her pani puri. She came to me from a reference through a friend in the States, and she ended up showing up to our practice. And I told her, I'm going to help you and I'm going to see to it that you can eat pani puri. The only thing you have to promise to me is you have to send me a video of you eating pani puri once you are done with your teeth. And that is exactly what she's done. So with this, I would like to conclude. Thank you so much for your kind attention. Thank you so much for showing up on a Sunday morning I'm sure it's a nice leisurely time with beautiful weather outside to go outside, but still you'll have taken your time out here. I hope I have added some value to your lives and to your dental hygiene. And if you still have questions, concerns, please feel free to reach out to us. I will make it a point to share that blog on how do you go ahead with flossing. And I would want Roy, if you could share that with all the participants, that would be really helpful. If you all have any questions for me, we will open the forum now for questions.
Munita, you have some question?
Means everybody understood everything or everybody slept off?
I think you explained things quite well.
Thank you so much, Joyce. Thank you.
Malcolm, you want to ask something?
Yes, Reynolds. Firstly, I wanted to compliment Doctor for an excellent presentation. I think, anticipating what kind of questions we would have, I think he preempted it and gave us all the information. So thank you, Doctor. That is my first compliment to you, firstly, for what you've done today. And secondly, I had a question in terms of the foods you eat. So we have this habit of having, a lime shot after a meal because it helps to, they say, to digest the food better. Now, lime shot, I saw in your section was acidic. So will it impact the teeth or?
So thank you so much for the compliments. And yes, with regards to your question about lime, it does actually affect our teeth, right? So lime is an acidic, it's pure citric acid. And what any acid does is it kind of weakens the enamel, right? So our teeth are primarily made up of calcium and phosphorus. It's called, this whole composition is called as hydroxyapatite. So because the acid tends to weaken the teeth, or I won't say weaken, but it tends to soften the teeth a little. If you tend to eat anything, or if you tend to brush your teeth immediately after that, you are likely to wear off your enamel much faster. So what I would urge you do is, if you are, you're very happy with this habit and you feel it's really helping your health in a very big way, what I would urge you to do is have your lime shot. Don't eat anything after that. Drink lots of water. So you are kind of creating an alkaline environment inside your mouth to neutralize that acid. So then that acid does not linger inside the mouth for too long. Right? So you could just go ahead, drink lots of water. That should really be of help.
Thank you, Doctor.
Most welcome. I hope I've answered your question, Taro.
Yes, you did. Yes, you did. Thank you.
Super.
Anyone else has a question?
I have Roy. Is it
Yes.
okay to ask now?
Yeah, please.
Hello, doctor. Thank you for that informative session. I have lost most of my teeth, 90% of my molars. I may be having just one or two with some caps. And is it possible at this age, I'm almost 60, to put implants?
It is possible at any age, very honestly. And there are some instances where it is impossible at any age. Right?
Wow.
So
Yes.
I'm going to just share when and when not. So
Okay.
if you are mentally absolutely confident that, I want this, then you are fit for this. I have 96-year-old patients for whom I've gone ahead and replaced a full set of teeth. So there's this widowed lady, she comes all the way from Cuff Parade and she travels by taxi with the help of certain people, and she comes to the practice. When she came to me, I was more reluctant about giving her teeth than but she really shared her desire that I want this. This is something I really am looking forward to. So I would really urge you to go ahead. And it was quite a complex job. So that's the reason I was not too excited about it. But she was mentally very headstrong that I want this. And if you are headstrong, means You can get it, you can keep it, you can maintain it. That's what I really care about, right? Of course, medically, you need to be healthy. Now, if I have a 30-year-old who says, I smoke 35 cigarettes in a day, that person I will have to reject for dental implants. Okay, so age is primarily only a number. It is your health status which is more important. If you are a diabetic, but you are a controlled diabetic, right? You are still in a very good position to receive implants very predictably. I have come across patients with missing teeth to me, and they shared with me that. When I was doing their basic work, the blood work, I checked that. Oh my God, your blood sugar is 650. It's hitting the roof. So for those individuals, also we got their blood sugars back to normal. We educated them about that. They met the right diabetologist, got their sugars in control, and then after that they've been doing fantastic. It's been 7 years since I've started helping patients like that, and they are all doing beautifully till date, and no concern whatsoever, no complications, no repercussions. And this is not just my data, this is global data that I'm sharing with you. So this is not just based out of my experience, but this is global experience based on literature that exists in the world, right? I hope I've answered your question, Anita.
Thank you so much, doctor. Thank you very much.
You're most
Yeah,
welcome.
thank
So please don't take age as anything more than a number.
Thank you, doctor. I have only a BP issue, but which is quite under control, and I have been looking forward to doing this for some time now. Thank you very much.
Most welcome, Anita. So blood pressure is not really a concern as long as it's under control. Because every second person has blood pressure. So it's a very normal thing now. It's a day-to-day thing.
Doctor, this is Marietta here. I just wanted to check with you, where exactly are you situated in Mumbai?
We are here in Ushiwara, right beside Lokhandwala. The the
Yeah,
Marks
I'm
and
aware of
Spencer's
that
building.
because I'm at Lokhandwala itself.
Oh, okay. So you know the Marks and Spencer's building, right?
Yes.
So we are on the 7th floor of the Marks and Spencer's building.
Lovely. Thank you so much.
Most welcome.
That takes us closer to you.
Wonderful. You can please feel free to reach out to me. You can see a number written there at the bottom. If you all have any questions, any doubts with regards to any problems that you may have, which you may not feel very comfortable to share right now on this forum, I completely understand that. You can please feel free to reach out to me. I would urge you all to send me a message on WhatsApp on this number, and I will call you back and I will get back to you. Right? So we work on weekends. We are only shut on Tuesdays. So Tuesday is usually my more relaxed day. So you can expect my call revert either in the evenings a little later or then definitely on a Tuesday. All right.
Any more questions?
Yes, Mr. Roy, thank you so much for connecting us with doctor, and I got more informations and about my dental things, and it was very important for me to know the knowledge about the teeth, the way you gave in a very simplified way, doctor. Thank you so much.
Thank you so much. Please go ahead.
And I had a question, doctor. That I am reaching 60 now, I'm 59 crossed, and I am as a cancer patient. And my chemotherapy has been done in last year, but I am on tablets of hormones for 5 years. And now I have developed osteoporosis. But my dental situation is very bad. As you said, it has been bleeding. The gums are bleeding. I can show you here. Yeah. So, as my oncologist has suggested me that once you have to take the injections of osteoporosis every 6 monthly, you cannot go for the dental treatment. So I want to know, because I am suffering from my dental things also. But the thing is that this is more important rather than going for the 6 monthly injections of osteoporosis. So I have a lot of pain now in my body. And even my teeth, even now I have started bleeding also.
Okay.
So doctor, I would need your humble suggestion. What have I to do?
So, ma'am, very honestly, since I assume you are on intravenous bisphosphonates, so that is a medication which does not do very well on the jawbone, right? So this kind of becomes a contraindication for things like dental implants. Okay, but this does not take you away from the dentist. So what you need to do is just simple preventive care so that you increase the lifespan of the existing teeth in your mouth, because everything is going to deteriorate. We
Yes.
need to reduce the rate of deterioration. Right? So we're not looking at doing advanced treatments and advanced therapies on you, but we are looking at kind of helping you in a way that we are prolonging the life of the existing teeth, so that I agree with what you're saying, that yes, you have problems,
Yes.
but these problems will become even bigger the moment you start losing these teeth that you have in your mouth.
True.
Right?
Yes.
So we want to prevent bigger problems. For that, we need to just do a little bit of simple cleanups and things like that, so that the future still you continue to be the way you are. At least you don't deteriorate dentally with time. That's the more important thing, right? And I will need to check those specific medications, and only then I can guide you with regards to what can
I
be.
would like to come and meet you, doctor. So if I can, if you share some number or any of your addresses,
Can
so
you
that I
is
am
this
in
number
Navi
visible
Mumbai.
on the screen?
I will share it in the group.
Okay,
Perfect, that
Mr.
would be
Roy.
great.
Okay, Mr. Roy. Thank you so much.
Yeah.
And this was the most concerning thing, and I was in need of consulting a dentist. And as Mr. Roy had just put, it was a boon for me to listen to you. So
I'm happy I could help.
it has been because now the things have been such a way that I cannot chew
Right.
some chapatis or any of the things which is hard for me. Any of the apple, even the apple, I can't chew. So it
Absolutely.
has been difficult for me as I can't eat. But I simultaneously the cancer treatment, I cannot stop that in between.
Absolutely.
Yeah.
I'll tell you, you're heading in the right direction, but it's very important to be aware of what you have. So I'm very impressed and very happy that you are very well versed with what is being given to you and how things are and why they are like this.
Yes.
I'm very happy that you are not ignorant about any of these things that have been shared with you, and I really respect that. But as I shared with you, I would want to go through your medical history a little more in detail.
Yes.
And I would suggest we do that maybe a little later.
Thank you, doctor. Thank you so much for your kind suggestions, and I will definitely come and contact you. Thank you. Thank you.
Most welcome.
Thank you, Mr. Roy. Mr. Roy has done a very big deed for me. And many of the things he has really helped me to contact with many doctors. Even his motivation in my cancer treatment has been a lot for me. Thank you, Mr. Roy. Thank you, doctor.
His energy is unmatched.
Yes. Take care. Bye.
Thank you. Mr. Roy, you're on mute. We can't hear you.
I didn't get it.
Yeah. If you can stop sharing screen,
yes,
then we can see all in one frame. Yeah. And can I request all of you to put your videos on? So doctor knows that you'll get 50% discount, huh? If you can put your video in 5 seconds on. See, Marina has come. Marina is your neighbor. And who all want a good discount? Doctor will. I'm sending this photograph to doctor, so he knows who all attended, who all are eligible for the discount. And these are all people who are having teeth problem. Unita, we have a flat for sale in Lokhandwala. In case you are interested. Sheetal, what happened to you? Jeanette and Jaredette, come on, put your videos on. Oh my God, this is doctor, your patient from London, huh? She's your neighbor, but iPhone Yvonne. Yvonne, you can bring your granddaughter next time and show doctor. You are muted. Acha, anyway, I'll just pick a snapshot. Sheetal, you will not get the discount, and neither will Jeanette or Pressy. I am taking the snapshot. This is a traditional way of saying thank you to the doctor.
Thank you so much. It's very sweet of you. Very kind of you.
Yeah, 1 minute, huh? And all those who did not put their videos on, doctor, please do not give them any discount. Yeah.
So I can't put the video on. I'm trying my level best.
No. See, that is
Fine.
Reynolds, doctor hasn't committed to the discount yet.
Terms and conditions apply.
No, he'll give.
My phone is waiting to hear the discount.
But you have to show this photograph. Because he will study the face, he'll study the. See, he told that whenever you go to him, he starts taking photographs. Oh, that's how it all starts. I think among all I can see, only Malcolm is getting the highest discount, it looks like.
I hope he doesn't need any dentistry.
Very selfish.
And who else is to come? Achha, let's see. Sheetal, just because you're in Pune, I think she's in Pune now. That's why she's not putting a video on. She knows she won't come to Bombay. Jeanette, what happened to you? Malad is allowed. This is not a 4 bungalow crowd. This is Malad also. We have got from London also. E1 is from London, huh, doctor? Okay, I'm clicking one more shot. Here we go. All right. And fine. With that, we come to the end of our today morning session. Thank you all for having come. And thank you, doctor. It was absolutely excellent.
Thank you, Duke.
Oh,
Thank you
so much.
Thank you, Dr. Hussain.
Chalo,
Thank
wonderful.
you, everyone.
amount
you,
of,
doctor.
amount
My
of
pleasure.
information you shared is brilliant.
Have a nice day.
It's
Thank you.
excellent. Reynolds, if
It
it's
was an
possible
excellent session.
to share doctor's presentation along with that flossing article that you sent.
Yeah, I'll put the video on. It's live on YouTube. I'll share it on the
All
group.
right, great.
Malcolm, are you on the group?
I'm on the group, yes.
Then I'm sharing it on the group in another 2 minutes.
All right, great. Excellent.
Yeah. So
Excellent.
all those who are in the group will get it now.
Thank a lot. Thank you.
Thank you, Mr. Roy. Thank you so
You're
much.
welcome, ma'am.
Oh, thanks, Reynolds. Thank you, doctor.
Welcome.
Most welcome.
Thank you, doctor. Bye.
Thank you, Doctor. Thank you, Roy. Bye.
Bye.
Take care. Bye.
Yes,
Have a great day. Have a great Sunday.
all of you. Yeah, enjoy your
Bye,
day.
everyone. Bye.
Bye.
Thanks, Roy. Thanks.
Welcome.
I'll see the video because I missed most of it.
Yeah. No problem.
Thank you, Roy.
Welcome.
Thank you, Roy. Thank you, Doctor.
Chalo. I think doctor has switched off, so you can only thank me now. Chalo, I'll end the meeting, huh? Unita, I'm ending the meeting. You're on mute, yeah.